Hello, my name's Adam Hamdy. I'm one of the co-founders of the John Snow Memo, which was a paper published in The Lancet in October 2020. And we're now 2 years on, and Dr. Deepti Gurdasani, who is the other co-founder of the John Snow Memo, and I thought it'd be nice to kind of catch up and look back at where we are 2 years down the line. Just by way of brief introduction, I got involved in the pandemic early in 2020 when I was asked by former cabinet minister Owen Paterson to do a sort of outsider's perspective for Matt Hancock on what I saw as the principal risks of the oncoming coronavirus pandemic. And the two things that I highlighted were the possibility of reinfection. I thought that was going to be a real risk looking at the data from existing endemic human coronaviruses. And the other issue that I highlighted was the prospect of long-term ill health, which was something that we had seen with the SARS, the original SARS outbreak in 2003 to 2004. And so those were the two key risks that I highlighted, and they were dismissed by the British government, who it seemed at the time were pursuing a herd immunity strategy, which was what was set out in the 2011 UK pandemic preparedness plan, which envisaged between 210,000 and 315,000 people dying within about 15 weeks, half of those dying within a 3-week period. And obviously we know the history that there was some kind of about face, and the UK went into lockdown in March 2020, on the 21st, I think it was. So I'm going to now hand over to Dr. Deepti Gurdasani, and I'm going to ask her how she first got involved in the pandemic, and to give us a little bit of background on what first prompted her to take an interest in this.
Oh, sure. So I first got involved in the pandemic in around March 2020 when, to my utter shock, the government and even scientists advising government started talking about herd immunity via infection as a public health strategy. And I think that was shocking for anybody in public health who understood that this would mean hundreds of thousands of people dying at a point where vaccines weren't even available. There was a very, very vocal group of, I would say, fringe scientists that I guess started something called the Great Barrington Declaration that argued for widespread infection, particularly in younger, healthy people, to attain herd immunity through infection while trying to protect the vulnerable through a strategy coined as focused protection. A lot of this was highlighted as pseudoscience even at the time, and I'm very, very glad that that strategy was not followed in most countries, because before vaccines were available, that would have no doubt led to hundreds of thousands of deaths. Even so, even though that strategy was not entirely followed, it's very, very clear that scientists were inclined to follow that strategy early on in several countries, including the UK, and that led to delay in action, which did cost at least tens of thousands of lives.
I remember, I think it was around April, May time 2020, there was a study that got a lot of attention saying that the UK had already achieved herd immunity, that the herd immunity threshold was 50% or potentially even lower. And I just wonder, looking back now, why you think such views were platformed and sort of given such prominence.
I think they were actually in movements quite early on, and I think this is something that's often missed in the discussions around public health, that a lot of these narratives are actually created, coordinated, and spread by vested interests who are aided and facilitated by a group of fringe scientists. But this sort of makes their views appear mainstream, even though they are the minority in the community. I don't think the majority of the scientific community endorsed or agreed with the policies that would have been, I guess, supported by the Great Barrington Declaration. There was a scientific consensus, which is what we put forward in the John Snow Memorandum, which recapitulated the evidence at the time, which was very, very clearly against this approach. It was an approach that argued for suppression of the virus until we understood more about long-term immunity, until therapeutics and vaccines at least were introduced, and one that showed that the spread of the virus was airborne, and we needed to use approaches that dealt with airborne spread of the virus. And all of this was well within the scientific consensus. So I guess there's a real question about how these narratives took over, despite being completely unevidenced, got the platforming that they did, the resourcing that they did. And it's very clear that there are connections between these sort of narratives and the people who support them, and things like climate change denial, and the fossil fuel industry. And there have been vested interests such as the AEIR Institute that that worked along with the authors of the Great Barrington Declaration. And since then, there are many other groups that have come into existence who are funded in ways that we don't fully understand, and receive funding by, for example, venture capitalists, and platform these views widely and disseminate them, even though they are not part of the scientific consensus.
I think one of the things that strikes me is that there were two things that I think played to the Great Barrington Declaration's hand. One is that it was official policy. The 2011 pandemic preparedness plan says, let the virus spread, and it actually envisages an influenza virus. And as I mentioned, it talks about hundreds of thousands of deaths in a very small space of time. And it says we should not close schools or shut down any sections of society. The plan should be to keep going. And only in extreme circumstances should there be any kind of lockdown, which tells me, given the scale of mortality and then the associated scale of sickness that would have been involved, that the planners actually had no practical understanding of what was involved in 105 to 165,000 deaths in the space of 3 weeks is what they'd envisaged. I mean, that's, given what we know now, would have been quite terrible. But obviously that was the official plan. That was it was a well-regarded and internationally sort of fated pandemic preparedness plan. And I think the other thing that's been apparent is that people, quite rightly, none of us have particularly enjoyed the experiences of trying to mitigate transmission. People, often will like to be told what they want to hear. And so I think that played very strongly for the the sort of scientists that were pushing for a sort of let it rip, open up strategy. Obviously, we then got together unfunded, without any vested interests behind us or anything, and just sort of said, because it was very apparent that the general consensus, within the scientific community was, don't do this, until we understand more, until there are vaccines, stop transmission, cut it down as much as possible. And so we got together, seeing this unfold, a kind of core group of scientists, and put together the John Snow Memorandum, which was then signed ultimately by over 7,000 scientists and medics around the world. And we actually ran out of resources to collect signatures. So, we have no idea how many people it could have got to in the end. Where do you think then, because what happened then, certainly from my perspective, is that kind of consensus unraveled, and that broad church that we'd built started to kind of turn in on itself as policy changed. What do you think happened post the John Snow and the Great Barrington period? And how do you think that was impacted by political policy, and vice versa? How do you think it had an effect on political policy?
So, when we talk about unraveled, I guess we have to talk about, what happened to the different voices, I guess, that came together and supported it initially. But when I look at the actual consensus that was voiced, it was entirely valid in light of what we know now. I mean, we supported the precautionary principle. We said we don't know about long-term immunity and whether herd immunity can even be achieved via infection. So, don't put your eggs in that basket. And even if it could be achieved, the consequences would be, millions of people dying across the globe. So this is not something worth doing. Focused protection, protecting a group of vulnerable people while letting an infection spread across the population is not going to work, which is what all the evidence that has come out since then shows. It's an airborne virus, use airborne precautions. All of that came true. Long COVID is something that we need to be careful about. We don't understand it yet, so don't risk mass infection, even in young, healthy people. That's what we said in the memo. We said that vaccines and therapeutics were likely to come out soon, and that it was worth waiting for those before exposing people to infection. So when I look at what was written in the document, there is nothing actually that has been subsequently disproven. In terms of what happened to the scientific consensus and the support for it, I think what happened is that vaccines and therapeutics came along, and a lot of eggs were put into that basket, and they had a huge impact. I mean, there is absolutely no doubt that vaccines saved and have and continue to save millions of lives. But what also became clear, and I think was clear to many people right from the beginning, people who studied other coronaviruses, is that SARS-CoV-2 was rapidly adapting. It was rapidly adapting to escape vaccines, to escape the immunity that was developed in the population through infection. And I think that left even many scientists behind, because I think many scientists could not perhaps cope with the idea that we were dealing with a virus that even with vaccines would cause huge disruption at societal level, huge pressures to healthcare services, mass infection and disability, even in young, healthy people. So this wasn't just a disease of the elderly or the vulnerable, but a disease that could affect pretty much anybody and have devastating impacts on their lives, and not rarely, quite commonly. And I think that started leaving people behind, because there was a group that emerged very vocally that suggested that vaccines and therapeutics were the end of the pandemic, and that nothing else was required. So all the public health measures that you put in to prevent a disease, to test people who are infected, to isolate them from society, to take airborne precautions like masks, ventilation, all of that was pushed aside in favor of therapies. Initially, testing was also considered part of this, although that also fell by the wayside. It seems to be more of this sort of Western approach where there's a reliance on sort of cures and technology, taking your way out of this rather than basic prevention measures. And I think that's where you see a divergence between a lot of the Western world and Southeast Asia, that from day one was putting in public health measures. Actually, vaccines were not available in much of Southeast Asia when they came out in the West. I mean, the West hoarded vaccines. We know this. There wasn't global equity. But if you look at the number of deaths, paradoxically, the number of deaths are far higher in the Western world than Southeast Asia. Even now, when Southeast Asia has also largely opened up in many, many parts of the world, you still see huge differences. And the differences are essentially in understanding the importance of basic public health measures to prevent, rather than just relying on vaccines and therapeutics. So this idea of multi-layered measures and the need for them became lost where vaccines and therapeutics came in. And paradoxically, what I find is, you would think vaccines should massively have reduced deaths. And while they did, what Western society did was, instead of using that and putting in multi-layered measures to suppress the virus, they then opened up the economy, because there's a huge focus on, I guess, free market and capitalism, which meant that we started tolerating much, much higher infections and much higher levels of deaths, because we had vaccines, rather than actually keeping infection at the same level and deaths at a much lower level. So vaccines, rather than being used to protect public health along with other measures, were actually used to further economic interests. And I think that's where a lot of the West failed, and that's where a lot of the division in this consensus has happened.
Yeah, I mean, there's so much to sort of unpick there. I mean, I obviously, as I mentioned, one of the big things that I highlighted back in February was the prospect of reinfection. And, certainly on social media, the COVID world is quite small. You end up encountering people, in the course of the journey And I remember talking to a very high profile journalist in, I think it was about May, June 2020. And I said, look, reinfection is going to be a thing we're going to see. And she said, I can't cope with that. I can't believe that. I can't accept that, because it's going to make life so difficult if it isn't just a once and done virus. And it informed her whole, she was very, very, very influential and, huge follow account on social media, and also writing for a very big paper that has a lot of influence and reach. And her whole unevidenced belief underpinned the slant with which she approached all of her writing, all of her interviews and articles, and also who she chose then to talk to, because she always sought out views that echoed her own. And I think, you're absolutely right. If you look at Southeast Asia, what they did was go back to the basics of public health, and they have, consistently still now kept their mortality count down. And I remember early in the pandemic, sort of around May time, hearing from friends, people who'd had the virus, who were talking about these long-term effects that, had been seen with SARS nearly 20 years ago. And it kind of alerted me to the fact that we were actually seeing what I'd talked about in February, which was this long-term ill health. And I think the difficulty with this virus, and actually all respiratory viruses, is some people will just shake it off. With or without a vaccine, they will just shake it off. Other people will have, a more severe illness and have a longer recovery time. Some people will not recover for months, maybe years, and other people will die. There's a spread of outcomes, even without the vaccines. The vaccines have actually made that spread, narrowed it into a much more a kind of milder outcome is more likely because of the vaccines, which is brilliant. But what it means is that a personal responsibility approach doesn't work, because some people will just have a light outcome. It will genuinely be a sort of flu, a sort of 10 to 15-day respiratory illness for them, and then they'll recover. And so they have their bias confirmed that actually this isn't a serious thing. But what they don't realize is then next time they catch this, they'll go out, won't isolate, won't test, they'll go out into the community and spread it. And ultimately it will find its way to someone who has a long-term impact or a more severe outcome in the form of death. And that's still going on. And it's surprising to me how many people don't know that we're still seeing, hundreds of COVID deaths a week, thousands of people getting long COVID, which we still don't properly understand. And we were talking before we started recording about actually the ways in which you can protect yourself from this virus. And so I just wondered if you could talk a bit about that and how easy it is, or relatively simple it is for people to protect themselves from catching the virus and stop transmission, and why you think that message has been complicated and convoluted and not reached the public.
So, I think there's many dichotomies that have been created in this pandemic. And I think one of the most damaging ones is you have a society without any mitigations, with mass spread of infection, which is harmless, versus lockdowns where, people can't go into work. Some people really suffer and struggle in terms of their businesses. People struggle in terms of their mental health, when in fact lockdowns are a failure of public health policy. There are countries like Japan, South Korea, who never had national lockdowns because they preemptively prevented spread, which is what the Western world largely failed at doing. And their main method of controlling infection became essentially lockdowns at a point in time where there would be huge loss of life if they didn't do anything. They took no preemptive action. This is an airborne virus. It spreads like smoke through the air. We know how it spreads. And not only do we know now, we've known this since February 2020. It was clear, regardless of what different public health organizations and different individuals may have said. A lot of the push against the idea of airborne transmission seems to have come from, for example, in the WHO and other organizations, from worry about resources. Will we have the resources to combat this if we say it's airborne? So it's been sort of resource-based information or decision-making rather than science-based decision-making, which is hugely problematic. And had this messaging come out earlier, I think it would have saved lots of lives, but many people still don't know it's airborne. If it spreads like smoke, then the only way you can prevent spread is by using masks that are well-fitting and filter the little droplets in which the virus spreads in, which we call aerosols, by improving ventilation so you can dilute the aerosols, or by filtering the air so that those aerosols are sucked out of the air and their concentration in a room is reduced. Those are the primary means, and they're highly, highly effective. You know, unfortunately, there have been disinformation campaigns that masks don't work, that air filtration is not worth doing. That's all wrong. They work massively, and they reduce your risk hugely. In fact, they reduce your risk even more than vaccines do in terms of transmission, but they are probably the most overlooked tools in this pandemic. I mean, there is absolutely no country that I can think of in the world that has done this well. You know, even perhaps, you know, Japan comes close, or Taiwan, but, you know, there's no country that's has high-grade mask use in the community provided by government with good messaging about airborne transmission, with good rapid testing, support for isolation, and with air cleaning or good ventilation, where particularly in indoor environments like schools and workplaces and businesses where spread happens. With all of those tools, I mean, you can easily suppress this pandemic, particularly with the levels of population immunity we have in many countries right now. In the UK, for example, we're on a fourth wave in this year. But, you know, if you look at the growth rate of the pandemic, it's nowhere near how it was in the beginning of the pandemic because of the level of immunity we have in the population, despite the fact we have no mitigations. So if we had a few mitigations, we could massively reduce societal disruption with just very, very simple measures, not lockdowns. Lockdowns not required, you know, but unfortunately, this has become almost like a culture war or a libertarian ground for ideology where science has no meaning. Whereas actually simple measures like that would protect everyone. You know, this is not a disease of just the vulnerable in society. There are people who are young, healthy, work engaged, who no longer can work because they have long COVID. This is a virus that persists in your body. It's a virus that affects every single system in your body and can, even if you're healthy. You know, it hugely increases your risk of heart attack, stroke, diabetes, clotting, a lung dysfunction, kidney dysfunction. Why would you take that risk when there were very, very simple measures that could be put in place to prevent that risk for you and the people around you?
I mean, it's fascinating that you talk about it spreading like smoke, because there's a lot of analogies to the smoking, anti-smoking campaigns, the pro-freedom, I want to smoke indoors on a plane or in a hospital. People used to smoke in hospitals. There's a lot of analogies to that. I think just, briefly, it's worth pointing out that all the aerosol engineers that you talk to say, we can do this. We can clean the air and take not only this virus out of the air, but flu viruses, as well, and other viruses. And when you think about the links that are being now shown between Epstein-Barr virus and multiple sclerosis, for example, other viruses and other long-term illnesses that we know about, why aren't we trying to do this? Well, the simple answer is cost and disruption. Because, these tools that the experts, and by experts, I mean sector experts, people who really know their stuff about building engineering, air filtration, not people who are experts in other fields who have decided that they can pontificate on social media about all sorts of things. The real subject matter experts say, we can take this, we can do this, we can take the virus out of the air and make things safer for everyone. And people say, well, you're not going to be able to get rid of every infection. But that's not the point. When do you ever ask? You can't stop every death from car accidents. You can't stop every death from alcohol abuse. But you try and reduce as much as you can. And so I find it interesting that the people who really know their stuff and who are experts in kind of doing building design, safety, aerosol, are saying, we can do this, we can tackle this. And if you look at BSL-2, Biosecure Labs, BSL-3, and you look at the fact that they wear masks, they use filters, hospitals do air changes, massive, filtration and ventilation systems. We know this stuff works. So the shade that's been cast on masks, well-fitted, N95 and FFP2 masks, the shade that's been cast on them and their effectiveness is completely unmerited, because we've known for decades that these things work. And the issue is actually their deployment in society, their cost, the practicality of it. And I think that, you know, there has been this rush to, you know, to want to get back to normal, to pretend that it doesn't exist. And what we're now seeing is the disruption that many of us forecast, which is, even if it's just a cold, if you have 10% of the population becoming ill within a 3-week period, you see supply chain disruption across all industries, transport, travel. You know, airlines have struggled to maintain their schedules. We've seen that. Shipping, manufacturing, we've seen it across all industries. So even if it's no worse than a cold, that simultaneous illness, which we're seeing with these recurrent waves, is still going to cause economic disruption. But we know this is worse than a cold. And if anyone's interested at watching this, Dr. Gurdasani and I worked with Mark Deforge, who's a coronavirus specialist, and has been studying them for 20 years, and Anthony Leonardi, who's an immunologist. And we wrote a paper on the long-term risks, which we started in August 2020, looking at all of the things that you talked about, you know, organ damage, immune dysfunction, and all the sort of things that we suspected might be happening. And most of those have come to pass, including the issues about evolution that we talked about. And so I'm wondering, you know, we've talked about how the sort of let it rip crowd took control of the agenda, and how, you know, what they had to say was enticing, and the fact that it fit with certainly the UK's official pandemic strategy. Why do you think people kept listening to those same voices? You know, we know who we're talking about, who said, you know, the pandemic's over, herd immunity's been reached. The number of times I've heard people say, well, this is the last wave, you know, that's it, it's all over. Famously, people talking about India's experience and how, you know, the hit that they'd taken meant that they were going to be immune right before the Delta wave then went through India. You know, so many people have got it wrong, and yet they continue to be platformed by the media and by governments, you know, sort of listening to them. Why do you think people haven't looked around at what's happening and said, well, hold on a second, this isn't supposed to be how it was supposed to go?
I mean, I think there are two reasons. I think one is perhaps a more psychological one, and the second one, the cynical part of me and all the evidence I've looked at tells me is more of a global campaign. So I think on a basic level, there are people who probably are in more privileged positions in society who perhaps need to believe that, you know, things, or can't cope with the idea of, you know, a mass airborne virus spreading that can affect any organ system in your body, even if you're young and healthy, one that you personally have actually very little control over. You know, the fact that you can be affected is very, very scary. You know, if you're in one of those privileged positions where, you know, generally you think you're immune to things, and unless you know somebody who's been affected, or care for somebody who's been affected, you might think that the risk for yourself is very low, unfortunately, up to the point you get infected. I mean, I know many people with long COVID now who say, I had no idea this could happen to me. You know, I myself became disabled over the course of the pandemic. And I can tell you, until you get disabled, you think you're immune, you know, you think, and you don't understand what chronic illness is like. You don't know how devastating it can be and how it changes your life. And I think there are many people who live in a hopium and copium bubble because they can, and perhaps they're more privileged in society in that they have not been impacted as much. And I think, unfortunately, you know, we look at experts as people who constantly take evidence, put it together in a very factual, unbiased manner, but that's not the case. We know that people are affected by their own personal circumstances and by their own ability to see the world as it is. And I think many, many experts, unfortunately, have not been able to. The more cynical explanation, which I think has played a massive role, is there are clearly vested interests influencing this. I mean, there are positions when we did the John Snow memo that 97% of scientists held. And then there were fringe positions that 3% of scientists held, perhaps. But they were always presented as equal, or perhaps even one skewed over the other. So what you see on social media, what you see on media, is a very, very skewed picture. And I don't think that's just the naivety or incompetence of media. I think it's deliberate. I mean, there are newspapers that I won't name, but there are many of them that have supported the normalization of mass infection with COVID, supported the idea that COVID is now the flu and nothing really needs to be done about it. And, people read these newspapers, they listen to experts. What are the experts telling them? Unfortunately, it's the same. You have people, scientists and public health officials who are willing to become complicit with this in exchange for some reward, or perhaps find it too difficult to deviate from a position of government. They're not independent enough. And what we've seen all over the world is scientific leadership, public health organizations let people down, governments let people down. And I don't think that this is just incompetence. I do think that there is a global push by vested interests that have put out disinformation campaigns that have made one side far more prominent. And that's what people see without realizing that this is not the truth. It's the same thing they did with climate change. I mean, climate change wasn't recognized for decades and decades and decades. Even now, those voices are very prominent. It's the same thing that happened with tobacco regulation, like you said, with smoking. Smoking regulation took so much more time. And in that process, so many people died and got ill because vested interests, it was in their interest to not have those things come in place. And that's exactly what's happening. There are vested interests who want the economy to be open, want people to feel safe when they go out. And part of that is removing the symbolism of masks, which shows things aren't normal. Part of that is pushing against air quality standards, which they think will, push them into greater regulation in terms of, making environments safe. So all of that is a huge push by vested interests. And, there's very strong evidence about this all across the globe. And all of these groups are connected. If you look at the number of scientists in them, they are still the minority, but they look huge because they're resourced. We have no resources. We sit on social media debunking one paper at a time. It takes so much effort and time to debunk things. It takes almost no effort to put out disinformation. So we are fighting a very well-resourced, coordinated campaign. And sadly, 2.5 years, even after the evidence is so clear and the consensus that we predicted has come to pass, we are actually on the back foot. And what we're seeing around us is the Great Barrington Declaration, which has won, in many ways.
Yeah. I mean, it's not often that I'm going to disagree with you, but I am going to disagree with you here in the sense that governments have played a bit of a confidence trick on people. Because if you look carefully, and you have to dig, the UK Health Security Agency is very clear, and its advice is ensure adequate ventilation of indoor spaces. They are advising people to try and reduce the number of times they catch COVID. They are advising people to avoid going out and infecting others. They are saying use masks when you need to, when you're in an indoor space with a lot of other people. Make sure you have good air change in your indoor spaces. They are giving that advice. It is not publicized. It is not widely known. But if you follow them on social media, if you check their website, they are quietly whispering to the public.
True.
To do, but I'm also going to say the WHO is doing the same thing. The WHO, Mike Ryan recently said, do not catch this virus once. And if you've caught it once, don't catch it again. And he said, I wouldn't want to be one of those people who you've caught it 3 or 4 times. I know loads of people who've now caught it 3 or 4 times. And the reason Mike Ryan says, don't catch this 3 or 4 times is because he articulates it well. He says, we do not know what the long-term impacts of infection and multiple infections are going to be. That is the official WHO advice. And again, they say, keep your distance, mask up when you need to indoors, ventilate. They're all saying, the public health bodies, similar to smoking, are saying quietly, do these things. Governments have obliterated that messaging completely and just said, go ahead, get back to normal.
But it's not just the governments, it's the leadership of those organizations as well. So yeah, all of this is written in UKHSA documentation in some of their tweets that don't get attention. What are the leaders of the UKHSA saying? They've been saying masks don't work, they're harmful. Yeah. They've been saying infection in children is fine. Children don't need to get vaccinated. Schools don't contribute to transmission. So this is the problem. You can have public health agencies put down well evidence advice that people can go and read, but you can have their leaders going on media and saying all of this, which is what people are listening to. Same with the CDC. What is the leadership of the CDC saying versus what's written in CDC documents?
Right. So my advice to anyone watching this, go and look at the public health agencies' websites. Look at the WHO, look at the UK Health Security Agency and the CDC and see what they are doing. Because on those websites, it's like the small print in an agreement. It's telling you what's actually going on. And a lot of it is well evidenced. If you look at the ECDC, the European Centre for Disease Control, you look at them, they do the same thing. They have all of their evidenced, scientifically backed advice. It's quietly put out and it's saying exactly what we're saying, which is try and minimize the number of times you catch this, use airborne precautions, ventilate, if possible, filter, and if you have no alternative and you're indoors with other people, wear a mask. So our advice is still not fringe. It's not like we've been pushed out to the margins. It's just been suppressed. It's kind of like it's been weighed down by the sheer weight of let's get back to normal kind of, okay, we're just going to get on with life as if it was pre-2019. But if you go and look, it's not conspiratorial and it's not kind of pseudoscience or anything. Go and look at these agencies. They're all saying the same thing, which is what
I mean by fringe is it appears fringe. There is a consensus that exists and is evidence, but that's not visible. And that has the same effect. If you're not informing the public about that consensus and the fringe voices take up huge amount of space in the public consciousness, then that becomes problematic because people aren't informed. Even when you tell people, you take personal responsibility. If people don't know the risks, people don't know the risks of long COVID to themselves, their families. If they don't understand this virus spreads like smoke, how can they possibly take personal responsibility?
Exactly.
Even if that were possible in a pandemic, which it absolutely isn't.
Yeah. And I mean, when you see people like Dr. Wes Eli and Professor Ikiko Iwasaki, and the research that they're doing and what they're finding out. And I think either today or yesterday, she was talking about this emerging neurological, I can't remember what her exact words were, crisis, I think was the word that she uses. But basically, they're doing research that suggests this is going to have real impacts on people's long-term, that's just one area, the brain, neurological health. And when you take everything in the round and you look, as you said, at cardiac, kidney, lung, immune, this is not something that one necessarily wants to catch multiple times. And so for the people sort of watching this, what advice do you have in terms of, I mean, I imagine that a lot of the people who end up watching this will already be quite COVID aware, airborne precautions and stuff, but they're going to have people in their lives, because we all do, who are sort of more skeptical and kind of, oh, it's no big deal, it's just a cold now. What advice do you have for people who want to try and convince others, talk to their, family, friends, or even at work or in their place of work where they want to try and make things safer?
So I'd say first, COVID is not the flu, okay? It's much more transmissible than the flu, and it causes much more damage. Like I've said, increases the risk of pretty much every systemic disease in your body. And I will say this is not uncommon. Even if you're vaccinated, if you're triple vaccinated, you're boosted, the Office for National Statistics shows that your risk of developing long-term symptoms if you get infected is around 4 to 5%. Okay, that's not a small risk to take. And that's a risk we know about. There are risks we probably don't know about yet that we'll figure out in 5 to 10 years, And it doesn't mean that you're just at risk. If you're elderly or vulnerable, everyone is at risk, So you can be an athlete, you can be doing ballet dancing, you're still at risk. And I would say that actually preventing this is very, very simple. So if there was a huge cost and burden to preventative measures to preventing those risks, then, there might be a question about, can I be bothered to do this or not? But actually, in this realm of personal responsibility that we're living in, there are simple things you can do to reduce your risk. Like I said before, it spreads like smoke. So you need to be wearing well-fitting, high grade masks. And by high quality masks, I mean things like FFP2, FFP3 respirators that are readily available online. And I know that they're costly, but you can actually cycle them. You can reuse them again and again and again so that they're as costly or not costly as surgical masks, and I would say ventilate. If you're in a room, and you can use ventilate. If you can afford to buy an air filtration device, buy one. If you can't afford to buy one, make one. There's lots of YouTube videos on how to make them, and they're highly effective. All of these things massively reduce your risk. Get vaccinated. Every single layer is important. So, try and make sure you don't get infected, but vaccination will help you if you get infected in case, you don't get severe disease. Make sure you test yourself, because if you're infected, don't go out into society, isolate, and encourage other people around you to test as well. All of those measures, they're quite simple to take, can make sure that you are safe. In summer, meet people outdoors or in ventilated places with doors open. These are simple things, for example, that my family, we've done for the last 3 years. We've managed not to get infected. I know many, many other people who've done this. And even if you do get infected, because many people say, well, I'll get infected anyway, so why not now? Every infection matters. I mean, there is some evidence to suggest that the damage on your organs is cumulative. Even if your first infection or second infection was mild, your third infection can put you into long COVID. So an infection delayed is an infection prevented. And there are therapies being developed every single day. Every single day, we understand long COVID more. You remember when we didn't have vaccines, the impact of getting infected when we didn't have vaccines was much bigger than the impact now. 1 year down the line, the impact of being infected is going to be less than I fully believe that. There are new vaccines being developed. There are new therapies being developed for long COVID. So if you can delay it down the line when we know more, it's worth doing. If you can delay your second infection, it's worth doing. So don't take the risk, because you don't have to go into lockdown. There are simple measures you can take, even if you go into transport, work, to make sure that your risk is minimized. And these are very, very, very effective strategies. High quality mask filter like 99% of the aerosols in the air, air filtration devices literally suck aerosols out of the air. If you can use those things, your risk is reduced by about like 80 to 90%. And along with vaccination, overall, your risk to health is massively reduced. So do it for yourself and for the people around you.
So, I mean, that's very useful advice. I used to consult for Philips Medical Systems. It's one of the reasons why I got asked to do this sort of outsider's perspective. And we've known for years, one of the things they do is build air filters. And we've known for years that their air filters can take 99.97. They're not allowed to say 100%, but 99.97% of flu virus out of the air of a room in 40 minutes, in, kind of a 100 meters squared average ceiling height room. In 40 minutes, they can take almost 100% of flu virus. The results seem to be similar with SARS-CoV-2, the virus that causes COVID-19. And, obviously you talked about building boxes for yourself, Causey Rosenthal boxes, they've been demonstrated to have a really, really, really good effect. They're really cheap to build, and you can put them pretty much anywhere you can get a power outlet. And they have, they're highly effective, they're very cheap, and they last for ages. So, there's no excuse really for people trying to make their spaces safe. And you see it all over the world, schools, universities, businesses putting these Causey Rosenthal boxes in. And you kind of see anecdotally the transmission, the illness rates. And there's one guy I'm thinking of in particular who had them put into his nursery where his child goes, and they just didn't have any in nursery school cases of transmission.
It's not just COVID. I mean, you don't have other respiratory diseases. I mean, I used to get ill every year so many times because my daughter's in school, and it used to massively affect me. I'm immunocompromised, and I haven't had a respiratory infection I haven't had a cold in 3 years, which is quite phenomenal.
Neither have I.
And daycares are kind of a breeding ground for those things. So, it reduces. And I don't believe that exposure to infection is a good thing for children if you can prevent it. So, you know, I mean, there were flu strains that were eliminated during COVID. I mean, if COVID didn't exist today, if it just stopped existing, I would still use ventilation, air filters, and masks, because I've realized they have so many advantages that we weren't aware of before, because we never tried to prevent things like flu, you know, which also cause mass disruption, you know.
I mean, it's interesting that you say that, because there was a time when people didn't try and clean water.
Yeah,
you know,
exactly.
where you just didn't try, and it's the same mentality where, okay, you've got a bunch of engineers and people who are innovating, saying we can do this, we can change the way we live and make ourselves healthier. And you've got a bunch of other people who are saying, oh no, exposure to disease is good for you. And it's very similar to the arguments that took place with water, right?
Yeah.
And ultimately we did this, we changed the way we treat water and made it cleaner, and we lived longer. We didn't live less because we weren't getting as exposed to as many pathogens.
Nobody talks about immunity debt to cholera and typhoid.
Right. You know, it made us healthier and we lived longer. And I'm the same as you.
Say, you know, this whole thing is a Western narrative. I mean, there's literally no country in Southeast Asia which has massive amounts of infection, massive amounts of experience with infectious disease and public health in a way that the West doesn't. No public health official in Southeast Asia is going to tell you that, oh my God, we've not had these infections for a few years. This is terrible for children. Nobody has this idea that infection is good for children. This is purely a Western ideology, I'm going to say, that has come into play.
But I think it's actually quite a recent thing as well, because until recently, no one really talked about immunity debt, and it's just not something that it seems to me something that's been held up quite conveniently to justify a course of action here in this pandemic, rather than something that's got an established history of scientific evidence. That there just doesn't seem to be that, you know, background of literature. And if you look at places that have got lots of endemic diseases, they're not places where people are living longer and are healthier. You know, it's just not a case that you need to punch bag your immune system to make it stronger. Just doesn't work like that.
I mean, chicken pox parties are purely Western thing too.
Yeah, but there's actually a lot of evidence to suggest that the opposite is true, that constant exposure to viruses, to other pathogens, makes, you know, kind of, it's harmful long term. And so, yeah, I think it's fascinating that you've got these people who are saying, we can do this, we can cut respiratory infection. And it's interesting, I'm the same as you know, just by taking some simple precautions. I haven't had a respiratory illness now for nearly 3 years. Well, I think 3 years. And it's not like, you know, I'm kind of living a restricted life with going out to eat all the time and, you know, going out to sort of garden parties and socializing and things. It's just, we're conscious and we take the precautions that you talked about, and do things outside as much as possible, and just put on masks when we need to go in to places where there's you know, shared air. So it's not, you know, it's not been it's been good, I think, for health, but obviously, you know, more fool me if we find out that immunity debt really is a thing, because then I'm in serious trouble. But you know, so I think given the sort of risks, and we're seeing people, you know, the ONS is showing people a sort of the long COVID, people suffering from long COVID is increasing. We're seeing the impact. You know, I think Chris Cuomo that in the States did a piece on it yesterday or the day before, saying that 40 million Americans are now suffering long COVID. Over there, they're seeing, you know, Federal Reserve is talking about it as having an impact on the economy. You know, it's showing through in the kind of numbers where you can't ignore it. And the question is, when do you think governments are going to pay attention to it? When do you think they're going to actually do something? When do you think they're going to act to protect people? So, I mean, first of all, I want to say, I do think even from an economic perspective, the government's actions have not been rational. They've been extremely short-term thinking. So in the UK, the Bank of England a few months ago actually warned about very high levels of labor being out of the workforce and economically inactive because of chronic illness. And they attributed that at least some of this long COVID, because, you know, it's something that happened during the pandemic and wasn't seen before. And we're now seeing this in many countries across the globe. We have
a lot of healthcare workers who have long COVID, who've left. We've got a lot of people in education with long COVID, lots of people leaving the workforce in essential frontline roles where, I mean, you can't just replace people. I mean, your human capital is your most valuable capital, and it can't easily be replaced, which is what I think many countries didn't realize. And, we're hearing that in the US, 4 to 6, probably about up to, I think, 4 million people are now out of work because of things like long COVID. So I think if we had a reasonable, rational government that actually was focused on the economy, they would recognize that actually suppression is far, far cheaper than having mass disability and mass disruption at population level. But they haven't realized that, because I think part of it is ideologically driven, because I can't think of any logical reason why governments wouldn't move to suppression. I think another reason might be that moving that way now would mean that a lot of people have been harmed in the interim, and accepting that, which I think would also open up a lot of liability for governments. And I think that is another key reason where there is a push not to do this. I think eventually they probably will have to, like they did with smoking. I mean, we had the same push against, smoking doesn't cause lung cancer, doesn't cause harm, a huge push against smoking bans. And I think that we're going to see pretty much the same thing until it becomes, I think it'll take about 5 to 10 years, to be very honest, for us to get there. And I think it's mainly because of lack of political will and certain scientists who are willing to, I guess, prop up the current really harmful policies, because I mean, you can't go on with millions of people getting disabled. But unfortunately, I think by the time any change happens, the damage will be so huge, and in many ways, for a lot of people, irreversible. And I worry about what impact that will have. I mean, in the UK, for example, we see the healthcare force has been decimated. I mean, COVID is one of the reasons, but it's an important one that has led to the decimation of healthcare. We're seeing excess deaths, both in Singapore, in the UK, now also in Australia, where people don't know what's causing these deaths. In the UK, it was suggested that might be healthcare pressures, but it doesn't make sense for Singapore and Australia, which have fairly resilient healthcare at this stage. And at least the Singaporean Ministry of Health has suggested that these are long-term impacts from COVID. So we've not even seen these. We're just beginning to see people, young people, die of strokes, heart attacks, pulmonary embolisms. And again, it's tragic. I mean, I don't know what else to say.
I mean, it is tragic. And, I think one of the things that was my guiding principle sort of throughout the pandemic was, looking at multiple data sources. And so when you've got mechanisms, obviously there's a lot of research now. I mean, I can't remember what we're up to now, sort of 70,000 studies on COVID on medRxiv and Research Square and everything. And when you look at the mechanisms, the biology of how, so the microbiology of how the virus is working, and then you see it manifesting in clinical presentations in hospitals around the world, what's happening to people, and then you see it epidemiologically, you see it at sort of population scale. You can't ignore that kind of evidence. And so you can see the mechanisms by which this virus causes clotting, for example, and then you see it show up clinically with people presenting with strokes and, cardiac conditions and pulmonary embolisms and all that sort of thing. And then you see that epidemiologically in the causes of these excess deaths. You cannot ignore that evidence, but people are successfully arguing against it and saying, well, it's, this, that, and the other, the same way exactly as they did with smoking. And it's kind of that obfuscation and, confusion that stops people from acting. But I just have 2 more questions, and then I think we'll wrap up. One is, I know when I was being very active and campaigning, I tried to get clean air into schools and lobbied the Department of Education over the summer of 2020 and was very active on social media. I know a lot of people kind of attacked my motivations and said, oh, I just want to sell books, because I'd left the medical, pharma consulting field and became an author. And they said, oh, you're just trying to get, attention and traffic to sell books. And one of the things I did was I did not promote any of my books from about February 2020 until December 2020. I just stopped and I said, right, okay, I'm going to show it's not in my interest. I don't care about books. This is a bigger issue. And I'm actually concerned about my friends, family, society, and children. That's why I'm doing this. Ultimately, though, I kind of said, well, there's no fighting the machine. And in September 2021, I said, right, that's it. I'm not going to do any more on COVID. I've had enough. I kind of saw the writing on the wall in terms of the way society was going. What motivates you and what keeps you going? Because you're still quite active on this. Why are you doing it? Because people will give you all sorts of, motivations about how it's, helping your career. I happen to know that's not true. If anything, it's been a detriment to your career. But so why do you keep going? Why are you doing this?
That's a tough one to answer. I think the good answer would be that it's all altruism, et cetera, et cetera. But actually, for me, I think there are a number of things. One is I do it because actually I find it less frustrating to talk about it than to be quiet, because in my day-to-day life, I have to deal with the consequences of what's happening in any case, whether I discuss it or not. And for me, informing people and talking about it is a way of perhaps coping with it. The second thing is, I'm immunocompromised. I've become disabled during the pandemic and I'm at high risk. And our household is now an immunocompromised household, and we have to deal with what is essentially mass denial in society by all of us shielding. And while we try and do like everything we can within the realms of what's possible here, there is mass infection outside, and I can't do many of the things. My daughter can't do many of the things she used to do, and our lives have become diminished. And I feel that to me, this is a justice issue. There is a huge public health issue, but it's an inequity issue. The people who are being impacted by this mass denial are predominantly people who are less privileged. They're disabled, they're immunocompromised, they're clinically vulnerable, they're Black and brown ethnic minority groups. They're people who are poor, who can't afford to shield. And I think, and the elderly, and also children, who here don't even have the option to get vaccinated in some age groups. And to me, that sort of injustice is something that's very hard to hold without talking about. I don't think I could hold the grief of that injustice. I think there's so much moral injury that is going on with what I can see in front of my eyes right now that's impacting me and so many people I know. Through the last 2.5 years, I feel like I've become integrated within a lot of grassroots organizations, the long COVID community, the myalgic encephalitis, chronic fatigue syndrome communities, the disabled community, parent groups, teacher groups, healthcare workers unions. And in many ways, because of the sort of advocacy that I've been involved in, I live with people's lived experience every day. People write to me about their lived experiences, the lived experience of their household members, and they are so tragic and painful that my only way of dealing with the amount of suffering that there is for these groups in society, particularly, is to keep talking about it, because I think if I don't, then I don't know where to put that grief, really.
Yeah, that's a very understandable motivation. And a couple of things I just want to draw attention to is that there is a group that is campaigning for the immunocompromised. And I think they describe themselves as the 300,000. That there are 300,000 people that are still shielding, that cannot benefit from the positive effects of the vaccines, and therefore have to use other measures to try and protect themselves. And, that is a huge, 300,000 people is a huge inequity. That's just in the UK. And the other thing that I just want to point out,
people, it's their families, it's their households, it's people.
Yeah, of course.
Yeah.
And people don't appreciate the fact that many of these people will have lived perfectly normal lives beforehand and had jobs in society and been fully functional, and this virus has come along and changed everything for them, and they're now being expected to take measures and shield indefinitely, and largely because as a society we're not taking the steps that are needed to kind of put the burden on everyone a little bit, rather than putting a lot of burden on a small number of people. And the other thing that I should have done right at the beginning is actually say that, you've got incredible, I know people have always tried to disparage your expertise and your, authority to talk on this subject, but you're, a medically qualified doctor who specialized in infectious diseases, epidemiologist. I mean, your list of qualifications is quite intimidating. And, you know, you have not only theoretical academic experience, you have practical experience of treating these kinds of diseases on the front line in hospital. And so I think, if anything, that gives you more authority than many of the people who have no experience of seeing these impacts, who have no contact with the people who are affected by this virus, and who aren't being, you know, written to every day and sort of being exposed to the lived experience of long COVID and these, you know, other issues. The last question I want to come to, and then we'll wrap up, is really where you see things going from here. And you've kind of alluded to the fact that you think there's a 5-year horizon. I'm a little bit more optimistic, which is unusual, but no, I think hopefully people will kind of realize, oh, you know, I've had this 4 times now. I don't really, and I'm starting to see it in sort of friends and family. You know, in fact, there's a friend of mine now who said he's got it for the 2nd time. O2 sats, oxygen level went really low and was told to go into hospital. And he said, I don't understand how this is happening again, because he was admitted to hospital the 1st time. He said, I don't understand how this is happening again. Biden declared the pandemic was over. How have I got this virus again? You know, and so I think people are learning from their experience and deciding they don't necessarily like it. They're kind of looking at everyone else and perhaps government to say, well, what do we do about this? No one's, you know, the mass sort of general population don't really understand what they can do and how they can protect themselves. So if you could maybe just talk a bit about where you see us going from now, and then we'll close up.
So I think there are a number of scenarios. So, you know, as we are right now, what we're seeing is a rapidly evolving virus. A lot of people now say that, you know, the virus is showing signs of convergent evolution that are very rapid. It's showing very quick escape from whatever we throw at it, you know, be it vaccines and therapeutics, and high levels of escape. And the consequences of that are, for example, in the UK and in many parts of the world, we're now on the 4th wave in 1 year. So, you know, you can argue about endemicity or not, but whatever, you know, whatever the situation is, we're clearly seeing huge levels of disruption every probably 2 months or 3 months in every single country across the globe. And these are not small waves. These are waves that are leading to severe disease. They're causing sustained pressures on healthcare facilities. They are causing mass disabling events. And, you know, I think that will continue for a while unless some action is taken. The things that probably give me some hope are there is at least some research going on in some countries on the vaccine side, where while others seem to have stripped back on it, which seems like a foolish decision to me, on things like, you know, mucosal and nasal vaccines, which may have greater potential, although I doubt that they will ever, or at least in the next few years, be at the point where you won't need anything else, you know, to prevent the sort of disruption we're seeing. Similarly, we are seeing, you know, advance on the therapeutic side, but they're not keeping up with the virus. And I think that's a very important point, because again, I don't see that situation changing unless the rate of viral evolution reduces, which we're doing absolutely nothing about. So I think it's a long road ahead, and I think it's a low road of mass disruption to society, huge impacts on public health going forward, until governments start realizing that, and businesses start realizing that it's in their interest to do something about this. And sadly, as you say, a lot of the public are getting information via being affected and having people around them affected, rather than information through public health organizations. You know, it's always better to get information when you can prevent things, rather than getting informed when you're actually affected, by which time obviously millions of people are impacted. So I don't see a very hopeful road ahead, but I do think that things will change over time, you know, because things have rapidly changed in terms of technology. But in terms of political will and implementing the understanding we already have, I'm probably a bit more skeptical.
Yeah, I mean, and you're probably right to be, you know, skeptical, because as you mentioned beforehand, so much of the Western approach to business and politics is very short term. You know, as somebody who's worked at the sort of most senior level with big companies, I know how executive thinks, you know, how they think and what their what their outlook is. And it's typically 2 to 5 years if you're lucky. You know, some people are only looking a year ahead because they're firefighting the whole time in their business. So, you know, for many politicians, the idea of implementing these kind of measures on a sustainable basis, it's just too huge. And they would rather just punt the problem down to the next person who comes into office. And people don't necessarily always understand that decisions aren't taken in their best interest. They're taken in the interests of what is efficacious and effective for society as a whole. So, you know, I think you're probably right. This is going to take a while, and like smoking, it's going to be a combination of things that all kind of come together at a certain time. But if you're interested, the science is already out there. If you don't already, follow Dr. Gurdasani on Twitter, because she's very good at not only sharing her own take on science, but also amplifying other experts and people who are actively researching in the field. So, you know, do look for yourself, find out for yourself, and also check those public health agencies and look at the small print and see what they're actually saying, not what their leaders and political leaders are saying. I'm going to say thank you very much for taking the time, Deepti, Dr. Gurdasani. I'm going to say also, just to recap, get vaccinated. If you're indoors, you know, high quality mask, N95, FFP2 if you're in Europe, and C95, I think if you're in Canada. Every country has its own, or every region has its own sort of standards. Find out, but it's effectively equivalent of N95, FFP2. Ventilate, open your windows whenever you can. Filter, if possible, using HEPA filtration, Corsi Rosenthal boxes, which you can find on YouTube how to build. They're very inexpensive. And the other thing, which now more evidence is coming out, is nasal sprays. Really simple saline nasal sprays. There's a whole range of them. They seem to have a positive effect. I kind of was talking about them in summer of 2020 because there was some early research that suggested they might have a positive effect. So there are things that you can do in the interim to try and protect yourself and your family from infection. If you want to gamble and you know, just kind of go ahead and live life as normal and get infected, do try and stay at home if you become ill and not pass this on, because it may be mild for you, but you will find somebody out there who it can be quite serious for. I'm going to say thank you again, Dr. Gurdasani, and I'm also going to thank the John Snow Project, who I think are going to host this video. We have no association or affiliation or anything to do with the John Snow Project. We just thought it'd be quite a nice fit for them to host this video, and they agreed to do so. So yeah, we have nothing to do with them, but we thought it'd be a nice place to put the video up. Hope it's been interesting and informative, and yeah, thank you very much for tuning in.
Thanks.